Healthcare and medical imaging devices in particular are vulnerable to these kind of attacks for several reasons. This is part of what we presented last year at RSNA. First, the healthcare domain is not as used to, you can say, to cybersecurity, because it wasn't the key motivation that people had when developing medical devices. So when people develop medical devices and medical imaging devices in particular, they think about how to make the patient feel better. They don't think how this device could be used in order to cause harm. So the entire industry should adapt to thinking like a hacker, and to think about the worst case scenarios that could happen in case the device is hacked. Second, there are a lot of regulations that need to be passed in order for a medical device to be used on patients. For example, the FDA has many regulations for deploying a device in a hospital or to a patient, and medical imaging devices in particular are very, very complex systems. So in order to pass all these regulations, which by the way are very, very important, because without these regulations, patients could be at risk. I mean, these devices are physically affecting the patients. So in order for a medical imaging device to pass all these tests, it takes a lot of time. So in a lot of cases, once they pass all the tests, and for example, an update or a patch comes out, they need to pass all these tests again. So think about it that whenever your computer asks you to update the Windows or whatever operating system that you're using, to update the system, so you'd have to pass a lot of tests that could take months. So even if you do pass all these tests, once you pass the test, another update will come, and then it leaves you vulnerable at almost any point of time.